I actually went to the U of A for my undergrad, was in the honors college there, and did a program called International Studies. It's changed since I was back in the U of A, but I chose different areas to focus on, and it was development, Latin America, and public health. I now also hold a master's degree from Johns Hopkins in humanitarian health, which has really helped me have that background to be working within social justice and health services promotion. And my work right now is with migrants, refugees, and immigrants, and that's where my area is. I guess I'll point to the next panelist, Chris.
Okay, that would be Ann Ryan. Ann is the director of the Tucson Family Advocacy Program and an assistant professor at the U of A Department of Family and Community.
Hi, thank you, Chris. It's great to be here with everybody. Our program is what's called a medical legal partnership. So there are 2 lawyers, of which I'm one, and we partner with doctors, nurses, other healthcare providers within our clinic, as well as in the community, like many of the people that are on this panel with me today. And really what we're looking at is ways to improve patient health. And so we try to teach the residents in family and community medicine, the doctors in particular, about the importance of screening for what we call social determinants of health, things that despite the best medicine, the best medical care, you're not going to get well if you're living in a house filled with mold. You're not going to get well if you don't have enough food to eat. So to try to help teach them about what can they do to help screen for and prevent or address different legal and social issues that are really impacting the health of our patients. So we do both teaching for them, some direct services for patients on the legal side, and lots of partnering with community members like IRC, the other refugee agencies, like Bernadette is also on the panel.
All right, well that,
Next.
Thank you, Ann. That sounds like a good segue into Bernadette Cornelison, who is Assistant Professor of Pharmacy Practice Science. And so Bernadette.
Yeah, hi out there. Thanks for having me here as well. I work closely with Ann, and I guess I'll get to that. I'm an alumni of the University of Arizona as well. I went to the College of Pharmacy here, and I graduated in 2012, so bear down. I am currently faculty. I've held a lot of roles, but I'm currently faculty at the College of Pharmacy, and I spend half of my time teaching and then the other half of my time at the Alvernon Family Medicine Clinic, which is where Ann also works. And I work closely with the physicians, the nurses, and the nurse practitioners there to provide care to patients that have diabetes, hypertension, hyperlipidemia, and to manage those chronic conditions. The patients that typically get referred to me are the refugee type of patient, or patients that are refugees, as they need maybe a little bit more time to understand the healthcare system and to navigate it, especially as it comes to medications. In terms of my role at the College of Pharmacy, I teach a course on OTC drugs. So if there's any questions on that, that's my expertise there.
All right, thank you, Bernadette. And our next panelist is Lissa Fogel. She is currently at the NAU Nursing School, which she's just began very recently. So this is a nice change for her. Prior to that, she was the advanced program coordinator for the refugee education program. So Lissa.
Hi, thank you. I also quickly want to give a shout out to Sarah Hagigi, who's just joining us. She is now the advanced program coordinator of the refugee education program. So if anybody wants follow-up questions on what they're doing, Sarah is here. Thank you, Sarah. It's so good to see your face. I graduated from the U of A in 2011 with my master's in language, reading, and culture. I got my bachelor's in anthropology from the U of A Arkansas long before that. I have done many different jobs, but got to meet the rest of this team as in my role of advanced program coordinator of the refugee education program. That is the English language component of the refugee resettlement program. And the people that stay longest in our program are the ones that have little to no formal education in their background, and are generally not literate in any language that they speak or have developing or emerging literacy. So we get to work with people on learning how to read and write while learning the language that they're learning how to read and write in a new system.
Mhm.
And so you can imagine, as Anne was talking about social determinations of health, and Bernadette had mentioned people needing a little bit more time to understand the systems, we also would work on that in the classroom setting.
All right, thank you, Lissa. Facilitating the proceedings tonight is one of our own Wayfinders, Laura Novotny. She is a pre-law academic advisor at the A Center. And so I will hand things over to Laura while I sit back and enjoy everything. So thank you all.
Yeah, thank you all for the introductions, and thank you for having me as your panel moderator. Bear with me, this is my first official Zoom panel moderating, so if anything, goes haywire, just chalk it up to first time. But like Chris said, my name is Laura Novotny. I'm an academic advisor here in the A Center, working primarily with our pre-law students as well as our undeclared students. So if you don't have your major yet, come talk to me. Or if thinking about law school, I know Michaela owes me an appointment. But I'm really excited to sit on this panel because to me, social justice, growing up as a white person in Iowa, where everyone is white, almost, right? Social justice didn't come to my radar until grad school, quite honestly, when I went to a program for higher education that had a social justice emphasis on there. And it still, to me feels kind of like this foreign concept that I feel like I don't know how to make a difference, even though I try. So really excited to see what our panelists have to say about, how social justice came to their forefront, and looking forward to all the different ways that they feel that they are able to kind of, enact social justice in their daily lives. So I will get this started with a question here, and then we will go ahead and turn it to the audience. I've got a couple questions in my back pocket as well, but I want you all attendees to be able to get your questions answered. But let's just start off with kind of a general one. I guess, how would you define social justice, and why do you think it's so important to the work that you do?
All right, I'm going to take a stab at it because I remember when we had met earlier last semester, or at the end of last semester, you had asked us this question. And, I go to a lot of presentations that talk about the definition, and everybody gives the definition, but it's like, what is my definition? And so the true pharmacist in me went to literature to look and see which one resonated with me, because I am not great at making up the definitions, as Anne probably is better because she's the lawyer in her. So I actually found one that I just really felt like resonated with me because it talks about social justice as both a process and a goal, not just like something. And so it was done by Bell in 2007, and it says someone who conceptualizes social justice as both a process and a goal emphasizes that the concept entails full and equal participation of all groups in a society that is mutually shaped to meet their needs. And for me, I think what I grew up in New Mexico in a Hispanic culture, and really, if you weren't Hispanic in northern New Mexico, then you probably were part of the minority there. And so this actually didn't come into my mind. I didn't even experience this until I came to Arizona, and I learned that there's different Hispanic cultures. And especially when I was using Spanish words that mean something totally different in different dialects, that was, I think, my big, oh my goodness, moment. And then I went out to Minnesota, and in Minnesota, I was asked if I had a green card because I was from New Mexico, and then I started learning a little bit more about things that were going on there, and I worked at a county hospital where a lot of Somalian refugees went for care, and that's where my passion just really came about. And a lot of the Somalian patients I worked with actually resided in a homeless shelter. And so one of my projects I started to work on was creating pharmacy services in a homeless shelter for patients there. And then it was heavily in the Somali population. So I got to work with them. I loved the work that I did. Came back to Arizona. It was way too cold out there. And I feel like my job has set me up to be able to do this. Like being a healthcare provider, you want to care for everybody and give everybody the services, right? No matter what their background is or who they are. And I think that makes it easier for us. And so we attract students that want to do similar things as well. And so what I try to do within my current role is really ensure that I'm able to do outreach. And so I mentioned before, like the whole having patients navigate the healthcare system, or at least the pharmacy system. And something that Anne had reached out to me before when I came here, she had asked, what is something that we can do to help our refugee population? And I said, well, our patients don't refill their medications. Like they go and pick up that first medication, but they never refill that second med and the third med. And lo and behold, we found out that these patients knew that they had to pick up the med, but they treated it as if it was like an antibiotic, right? One-time thing and you're done. But if it's for blood pressure, this could be forever that you need to take it. And so we created some outreach and some great products in which we got together with this whole group actually that's here and was able to do that. I think I went way off on your question from definition to where it's in my practice, but okay.
No, I think that was great.
All right.
I think, Bernadette, it's a good segue though, because although we do see social justice in a myriad of ways, I think it's access and being able to participate in a society and having access to resources for me. And when talking about how you're working or what your work brings, Bernadette, is that you're creating that access, right? As well as creating an avenue for people to be able to learn about their health as well as their medication adherence, so that social justice is available or pursued, or the goal is kind of captured. For me, when looking at social justice and having equity and access and participation and human rights being upheld as part of the definition, I think we can look at it from a health standpoint. And can also use education to make sure that people understand, what services are available to them, what rights they have. For example, it's a right in the United States to get interpretation, to receive medical services so that you could understand everything that's going on. But you won't get that unless you know that's one of your rights, right? So then there's that education component that we need to make sure that people understand what rights they have, and then we'll have access to them. Within our work at the IRC, it's connecting to individuals such as Bernadette, who's very passionate about our patients, understanding why they're taking a medication and making sure that they're taking it, and understanding what are the barriers towards access to care. It's also individuals such as Lissa, who is teaching or was teaching the English components of understanding your medication, and maybe going step by step and framing not only the language, but also the ideas behind things. And ultimately, I should say that social justice just doesn't end with one particular thing. It's just surmounted by so many connecting ideas and information and education so that we can reach that goal.
It's so hard to even know where to go from here. I'm learning so much. I made myself not look up definitions because I know myself, and I would have spent days reading everything that I could and written papers on it, and then panicked and not shown up because I wouldn't have had the right answer, right? Because that's just where my brain goes. So what I did was I tried to pull out of my brain, like, where does this sit in my gut? And I think it's finding patterns and who isn't getting equitable services or having equitable experiences due to some systemic problem that isn't meeting their needs, and then doing what you can to address it. And that wherever you are, it doesn't have to be top down. It can be the resources that you have at your disposal. And to elaborate on that, since Bernadette and Lisbeth did, I guess with this example of working together in a community, our curriculum could have been fixed. You know, here's what we have predetermined that our students must learn. And we're not going to change that because we have decided, right? But if you start to see a problem where people aren't getting the services, not just in your classroom, but out in the community that they need, and somebody comes to you and says, hey, we see this problem too, and we're working on it, can you help us? That's when you can step in and say, yes, let me change what I can, and let's try to solve this problem. Likewise, with our students not getting the same level of English tutoring out in the community, and not just in Tucson, but nationally, because English language programs presuppose literacy. When you're learning to teach English in a college program, it is assuming that you are teaching college students English. It's not assuming that you are teaching somebody who doesn't know how to read and write, or has not yet learned how to read and write in any language that they speak. And I've had very different experiences of education, formal and non-formal. So in order to address that, we went and we developed a training that combines best practices in language acquisition with best practices in literacy acquisition, because historically those are two separate things. And literacy acquisition is generally taught to children. And it's not extrapolated to what that looks like in an adult, especially an adult who's learning the language, because you need to map those sounds onto words. And so started by teaching students or teaching tutors in Tucson that how to do this. And then we started traveling and going to conferences. And I believe right now, Jenna, one of the women who was working on that program is working on changing curriculum at a university to include this in pre-service teaching. So like just how those things start and continue, and just starting with where you can, you know, small little English language program in Tucson.
So I love everything that everyone said, and could just, you know, focus on any one of your comments and go from there. I just, you know, for me, the notion that comes out, you know, listening to all of us talk, is obviously we're really passionate about the work that we do, and there are so many different ways to do it. You can be working in ESL classes, you can be working in nursing or pharmacy or law or at the community food bank. You can work anywhere and be able to identify that there are things that just, you know, as Lissa says in her gut, just don't feel right, just don't feel fair, and try to figure out who can you partner with to help narrow down what those issues are, what those barriers are, and try to make a difference in some way. You know, social justice actions aren't a one-time thing and then everything's fixed and the world is a great place. It's something that we're all in for the long haul. And certainly key to a lot of that is, as a lawyer, knowing your rights. I'm really big on that, and knowing how to advocate for yourself, so it's not someone else coming in and thinking that they have the answers to solve the problem. I will, you know, in our clinic, our patient population is about 25% refugees from many, many different countries. And even Lisbeth, who's working almost exclusively with refugees all of the time, none of us would say that we are competent in anyone else's culture and can begin to know, you know, what they've gone through and what would be best for them. but we can be part of that team with them to try to help figure out how to make changes in some meaningful way within the institutions that we're working in, or within our community. And I hope you all, if nothing else, know that there are many, many different ways to do that.
Wonderful. Thank you all for that. Those were very lovely answers, much better than what I could have come up with. So good job. Let's turn it to the audience. If you want to pop in the chat, or you should have the ability to unmute yourself. If not, raise your hand and one of us can unmute you. But we'll give it a couple seconds here, see if anyone has any questions before I just go through my list of questions. Again, I really want you all to get your questions answered.
Hi, yeah, so I have a question. I guess this is more for Anne because she's working in the legal field and was a nurse. How do you feel as if social justice has kind of morphed over the years, and have you seen a change in the way people approach it when you discuss it, I suppose?
That's a great question. I mean, there's never a bad time to get involved with social justice in my mind, but there couldn't be, at least in my lifetime, a more exciting time to be doing it. You know, I feel like I've always been an optimist, and maybe, you know, other people would be more cynical and not be optimistic, but I really think we have the opportunity now, with some of the horrific things that have happened in our country in particular over the last few years, that now there are people that before were a little more complacent. Yeah, they might know that there was a problem, but it really didn't affect them, and it wasn't, you know, as big of a deal, quote unquote. But now many, many of those people are actually have been awoken to how bad things are in so many areas, and saying that they want to affect some change based on that. And so I think things have changed, and I think this is just a golden time to really seize on that, and to make some meaningful changes. I know people, you know, undergrad students at the university, graduate students at the university, who are really getting involved for the first time in diversity and inclusion committees, and really pushing hard on faculty and more entrenched people on, you know, not paying lip service, but really doing something that's meaningful. And so I think that analysis is going on in a lot of institutions. And yes, in big institutions, there are always people who they're only paying lip service to it. But I think we have the opportunity and momentum now that we really could, with some focused attention, make some meaningful differences in the places that we work and in our communities.
Do we have any other questions? That was a great question, Michaela. Thank you.
I have a question.
Yeah, go for it.
Yeah, so I grew up around white people who had nothing, who went to the same schools as I did, and who wore the same clothes every day, who had backpacks that were ripped and they couldn't buy or they couldn't afford it. And then they went to universities, colleges, and had to take out loans because they were white. I guess because white privilege, male privilege, etc. And so my other minority friends and I have gotten several scholarships, especially my other friend who got like $70,000 in scholarships to go to the East Coast. All she had to do was just pay $1,000 a year. So is social justice only for minorities, or is it for white people who also need help?
The way that I was defining it is it's for anybody who's not getting equitable services. So if you're seeing a pattern where things aren't equitable, and you can collect enough data to figure out what that systemic problem is, you can do what you can to try to intervene with whatever resources you have, your voice, to maybe, you know, if you're in a if you're in politics, doing something at that level later. No, and I think something that we're finally starting to talk about on a national level is intersectionality, where there's more than just race or just class or just ethnicity or just sexual orientation or anything that historically has positioned somebody as a minority. All of those things intersect and can't be separated out.
And I think, Lisa, even to add to those categorizations, of course, there are also social economic status and access to education. So I think we have to, as a whole, when looking at social justice, not necessarily say this person is worse off than this person, but really find ways to fix the system so that those inequities are diminished, if not all hopefully deleted, right? Which is obviously a very optimistic way to see it, but really not prioritizing a specific group, but looking at it as a whole and catering to those specific needs, of course.
And to add to that, the access to healthcare, I think 80% of our patient population are Medicaid. I don't know if that's under, yeah, and just underinsured. I may be wrong with 80%, maybe it's higher or lower, but it's a large percent of our patient population, and understanding their needs and then meeting those needs is where we kind of go. And it depends, not even just on their race or their economics. It just depends on the individual. Like, what is that individual doing in front of me right now? What do they need? And then how can I help them? I think whenever you get to the larger impact and the bigger impacts, as Liz, I think, was trying to get to politics and everything, is whenever you start to see it being like kind of parsed out on where can we have the biggest impact that is visible to others. So, but yeah, I definitely think it's all inclusive.
Yeah, definitely a really complex question that if you're looking for a undergrad thesis at any point in your life, I think that would be a great topic of research, because I think that's a question that a lot of people struggle with, right? And intersectionality is definitely, kind of taking off, but, more importantly, what does it look like to take away all of the barriers so we don't have to worry about it in the first place, I think is difficult. So, all right, any other questions before I go to my list?
If I may interrupt one more time, isn't intersectionality victimhood? Because you're saying that because you're this race or you're this color or you're this sex or etc., that the system's against you. Isn't that kind of putting a victim mentality in someone else who is of different color than you? And I mean, I don't want to be rude and I don't want to be mean, but like if a white person came up to me and told me that because I'm black and because I'm a woman, the system's against me, doesn't that mean that they view me that way? And if they can't provide an evidence as to why the system's against me, doesn't that make them the racist?
I'm sorry, was it Imam? I couldn't, or how is it?
Iman.
Iman. I couldn't hear the last of your comment. Can you repeat?
Doesn't intersectionality kind of make minorities feel like they're victims, like saying that there's a system against them, and that because there's a system against them, that it should be quote unquote fixed?
That's a very difficult question to answer, I will say. And I think it also has to do with how you feel. You've been treated individually. I'll say, as I'm looking at I guess as we're talking about diversity and inclusion, there's many times in my life, in particular, that being a person of color, being a woman, coming from a small town per se, English not being my first language, where I've been asked, have you ever felt racism before? have you ever felt that there has been these systemic barriers that have been in your life? And there was times where I couldn't think back and say, oh, that's when that happened to me. But now looking at from a more analytical point of view, sometimes I can identify them, right? Once I've learned a little bit more about what those barriers or that systemic racism was there prior, now I guess I have the knowledge to maybe identify it in my own life. I personally don't see it as victimization, but more or less seeing it as an opportunity to grow. I've always seen that if there was a challenge for me, I've always wanted to go against that challenge and succeed. So it's actually maybe that systemic racism that I have been exposed to has pushed me further at times. But now when I look back on it, I might have worked harder than somebody who to get to that goal than somebody who would have had less access to education, or sorry, more access to education, or more finance, or like a higher economic status, or access to other schools, etc. Because of the color of their skin, or because they didn't come from immigrant parents or immigrants themselves. So it's interesting. I think it's very personal to look back at your own story or your own individual, how you identify, to see how that's affected you personally. I don't necessarily see it as victimization, but maybe a realization that those barriers have existed, and that if you are interested in pursuing to reduce those barriers, to really identify what might be the issue, right? That's how it is for me, and that's obviously that's a very personal note. But I encourage anybody who does have like all these different characteristics that you self-identify with, is just look back at your lives and see if that it was possible, something that you felt with a more analytical light.
And I think to take that a step forward, I can resonate with so much of what you said, Lisbeth. I like looking back at how fortunate I was to get to where I am, and then my classmates from elementary school and stuff that maybe didn't get to experience some of the experiences that I had, and what were the barriers that I had to overcome, or I did overcome, that they didn't get to, and how can we create resources to make sure that they know about, like, pharmacy. I didn't even know pharmacy existed until I decided to almost apply for pharmacy school, to be honest. I didn't know that a pharmacist had to give you a medication. And I don't know if I should say this because it's recorded, but I didn't know till I got to pharmacy school that the directions are on the pill bottle. Like, I thought the doctor told me what to do, and I picked it up and I took them. And so that, I think, for me is looking, and so now it's like creating those opportunities, or making sure that it's more visible to other students that are in rural areas, that pharmacy is an option. You can get in science if you're a female and you're, and you're interested in science, it's okay. And just being involved in programs that advocate for that, I guess that's where I kind of go, like, I lift off from there, is kind of how was I able to get to where I am, and my friends and classmates weren't able to.
Great. So I'm going to pull one from my list. Oh no, I just pulled my list. That's okay. When do you feel like you all started getting involved with social justice? Was it something that you knew that you were going to pursue, or was it more like, oh, I'm in this position now and this is what I should be doing?
Can I start? I actually, when the flyer came out for this and the blurb, I almost canceled, because I was like, I don't identify as somebody who spends my entire life or time like fighting for social justice. It was really hard for me to like show up under this banner. And then I had to sit with that uncomfortability for a while. I know so many people in my life who I think should be on this panel. And so I don't have like I don't have these academic answers to what social justice is, but I know that I was invited to this panel because somebody thinks that what I did and do falls under social justice. Um, and so if I look at my definition of finding patterns and who isn't getting equitable service and doing what you can to change that, um, I will say that I was born that way. I remember as a very young child growing up in my family, finding things that are just not right. It's not okay, not right. And then I find patterns and I try to address them when I can. And I've done that my whole life. I just would say it's part of my personality.
I love that, Lissa. I, I've also always been that's not right, that's not fair, you know, you can't do that to that other person. That, you know, I've always worn my kind of heart on my sleeve that way, and felt like that when I see something that just strikes my gut as not fair, that I want to do something. You know, as a little kid, cry about it, you know, was probably my big go-to. I remember my family took us on a Christmas vacation to Haiti when I was a young, you know, less than a teenager, preteen. And I remember spending a whole lot of that trip crying, and just the level of poverty and not understanding how any place in the world could treat people that way. And I think it made, you know, it made a huge impact on me from a young age. But I think that it's not like I said, you know, I'm going to grow up and be a lawyer and I'm going to change all of this. I had lots of things that I did before I became a lawyer. I didn't go straight to college, for instance. I went off and had a hippie phase for a while. When I did start to college, it was a community college, and went to nursing school, and loved what I learned there and the work that I did after that. And when I had my, I'm going to save the world and be a lawyer, even with those feelings, my first jobs were very traditional. I worked for a court, for a judge. I went to a respected law firm and worked in very traditional ways in litigation before I then had another, you know, growth spurt in my mind, and then started worked for Environmental Protection Agency. It wasn't until later, after time off with family, that I heard about medical legal partnerships, and that really seemed to meld my health background and my quote unquote justice, wanting to save the world background. And it's where I've been for the last 16 years. But I think at every step of that way, I would look for those aha moments of what wasn't fair, what wasn't right, and try to find like-minded people that could help me figure out what to do. I mean, there's no way I could figure out or can figure out how to start addressing or tackling any problem. But if I can surround myself with people who have more experience, who share my passion, my commitment, then we can at least take a stab at it then and try to do our part.
I'm honestly trying to think about this question as everybody's talking about it. And I think my experience with first seeing such huge inequities is just living in the border. I lived in Nogales, and you know, right between this town, which is one town, right? And it was more permeable. The border was a lot more permeable back then than it is now. You know, you do your grocery shopping maybe on one side of the border, and literally we call it the other side, or the other side, right? If you're on one side of the border, that's what you call it. We do our, we had school on one side, we had friends on one side. It was one town, but it was divided by a wall, a very permanent fixture, a wall. And it wasn't just the wall, right? On one side, you had what we call invasiones, which is tin houses of people who are trying to cross the border, who have semi-permanent living and sometimes end up having that be their permanent living. And then on the American side, you have access to water and sewage and cable and healthcare. And then you're on the other side, and there has to be a company that you have to hire to bring your water to your home, and you put it in tanks. And maybe you have a toilet, maybe you don't, just depending on what circumstances or jobs your family have. And so it was that constant reminder of, American side, Mexican side, and there's differences. And yet everybody kind of looks the same, right? Everybody speaks the same language, which I will say Nogales, Arizona has a lot more Spanish speakers than Bernadette. You would have been the minority there too. But it's interesting. Now that I think about it, it was then, right? It was then that I saw that disparity and that inequity, and being able to now work on refugee issues and migrant issues and work with individuals within the realm that I'm currently working in. It has definitely motivated me to try to bring those inequities up to a certain point, or even health programming to a point where at least people have access to health, at least people have an opportunity to migrate if they fit the parameters of finding safe haven in the United States.
And I don't know, I have no idea when I could say that this happened. That's why I like to go with there's a goal and a process to get there, because I feel like I've always wanted to help people and help others. And not to belabor the point that everybody else has made, I think it's just something that was a part of me, and I've done it. But I mean, admittedly, in undergrad, like I was like, when I was an undergrad at the University of New Mexico, I don't know if I really did much. Like I did in like the pre-pharmacy world and stuff. I think I did, but it was really when I think I got into pharmacy school, like I knew I wanted to help people. The reason I got into pharmacy is because I said I put it in my letter of intent that I was going to get into the drug companies and make all those drug prices lower, because when I was working at a pharmacy, I saw a patient that had to decide between getting their antibiotic or getting their kids' food that day. And so we bought the medication for them. And so for me, I guess that may be where the big moment was that you can say, but it's hard. And I think from there, it just continued on, and just finding things that didn't sit well, or something that I enjoyed doing too, and learning about others and helping others. And it's just kind of a passion, I think, of mine that I've enjoyed. Yeah.
Cool. I think that actually leads really well into a question that we got in the chat. So how do you prevent getting stuck on fighting for only one social justice issue that you're personally passionate about when there's so many issues out there?
I've been thinking about this question. It's such a good question, Bita. Thank you for asking it. I think when I was younger, I was all over the place and ineffective because I wasn't doing what I was passionate about. I was trying to do it all. And I realized that I can be an organizer, but that's not where I'm most effective. And then it doesn't keep me fed. And if you want to keep moving forward, you have to know who you are and what you can do and what makes you happy and what energizes you. And organizing campaigns does not energize me. I thought it did, because I thought that's what you had to do to be a social justice activist. But what it turns out I'm interested in is language and culture, and working with people who don't have the same access to services, And I found that in the refugee education program. I was able to be fed by learning about language and culture, working with a team of teachers and working with refugees who are here really by no choice of their own, and doing what I could do within that realm. And it kept me going. I can't do everything, but if I try, I'll stop doing anything.
Vita, I don't, when looking at your question, I don't necessarily think that fighting for one thing in social justice is necessarily a bad thing. Because sometimes when you focus on one issue, it becomes more attainable to find solutions. It becomes somewhere where you can specialize in, get more knowledge, get more specialization through school or through learning from other people's experiences, through research, that then you may be more effective in just working on one thing versus wanting to work on 27. Because there's more than 27 issues. There's probably thousands of issues. So for me, it's more or less, let's focus on one social justice issue, maybe at a time. So that then you could have your issue prioritized, and you can focus your time, energy, and efforts to that area of focus.
Thank you, Elizabeth. There's so many good points in there. And also, as you focus on one thing, you start to learn who the community is who's also focusing on those things. And as you build those relationships, then you can affect more change. And it takes a long time to build relationships.
Yeah, that's perfect, because I was just going to say burnout's a very real thing. Even if you're passionate, passion, I feel like, can only go so far, and then you really got to be the boots on the ground, and you got to work. You got to put the work into it. And so if it can be easy to try to jump from thing to thing as well, because you just, one thing's exciting, then the next thing's very exciting. But I think finding it and being able to put the work into it, and then trying to avoid burnout, because I think the question that Michaela had asked was like, how has it evolved over time? And that's really important, that even though now is a good time for call to action and get as much done, I think we still have a long way to go and a lot of work to do. And we don't want to burn out in these next like 5 years. We want to make sure that we continue we just continue to progress.
Right. And if you decide that there are, I agree with everything that the panelists have said, that it's really important to not to bite off more than you can chew, and to be able to learn the community and work with the community on that particular issue before spreading yourself so thin on 10 different issues. But once you've done that, you can always take the skills that you've gained, the connections that you've gained, and then apply them to another issue. So it doesn't mean you have to do it for the rest of your life. But I think trying to focus on something where you can make a meaningful impact instead of getting spread so thin is a really good idea.
Also, I think it's important to point out that the four of us who are officially on this panel are here because we worked on a project together with the same population. So it also seems like we're not talking about diverse social justice issues necessarily, because we all came together and worked on one project. So I just wonder if the representation also makes it seem a little skewed.
Yeah, I think that's a really good point. I can give you an example of how you can kind of take what you learn and apply it somewhere else. One of the things that we all worked on together was revising something that our program had designed many years before, about how to help people learn how to have effective medical visits, what you need to do to prepare, what you need to do while you're there. And we had developed those, but we didn't have Lissa's expertise on how do you teach anything to someone who doesn't have a base in literacy concepts first. How do we take these very complicated concepts around health and build them out in a way that would make sense. So although we all worked on that in terms of refugee populations, we've also for several years been using similar materials with a population of individuals who identify as having behavioral health impairments and do it in the concept of a course on self-advocacy. And so we use that as one session of the self-advocacy course. How do you advocate for yourself at medical visits? We have sections on how do you advocate for yourself with your landlord? How do you advocate for yourself at DES if your food stamps have been cut? And so any of the things that you get involved in, you can apply in different areas and use the skills that you gain and the connections that you make to help forge new partnerships and expand out in other social justice areas too.
And Beta, to your question as well. So we were all mentioning it's also good to focus on one thing, but there's so many things that we can do on our daily lives that affect social justice in general, right? The way we vote, the way that we decide on where to purchase items, right? Are basically our vote through our consumerism. Are we buying clothing that is made in a sweatshop versus made in a place where there's sustainable trade and living wages provided to the individuals who are making it? Are we recycling or reusing our products? So I think the decisions in our lives and how we live our lives is also a way that we can impact social justice. That takes minimal energy from us and that we can all do, and it's all attainable for us as long as we're informed about the consumer purchases that we do, how we're voting, how we're making our decisions.
Thank you for bringing it back, Lisbeth.
Yeah, that was great. And then we have one final question in the chat. And Sarah, you may have to chime in here because I am reading this and I am just, my mind cannot interpret it. So the panelists may understand it better than I. But what are the responsibilities of the constituents in regards to issues of social justice? That is the question in the chat.
Sarah, are you referring to voting? You're muted.
Sorry, I was just going to say in general, as regular citizens or individuals, what can we do for our fellow citizens or residents here to make it a better place to live in? Not necessarily in terms of politics. That could be one item too, but in general.
I defer to everything Lisbeth just said. I think that was great.
Yeah, totally agree. All right, so we've got about 3 minutes left. Let's have everyone wrap up with maybe just some of the best advice that they could give for, going potentially into these situations that may be, I don't want to say exhausting, right? But it's emotional labor, right? So what is your advice for going into, any sort of social justice work, however it's defined? Like, how can you maintain that sustainability and prevent that burnout?
The first thing on my list as I was preparing for these questions was be kind and listen to yourself first. If you're unkind to yourself, you can't show up. If you're unkind and impatient with yourself, you can't show up for others. So it takes a lot of work on yourself first.
I'm cringing at this question because I'm so bad at self-care. But I think learn self-care early and why it's important, and then make small changes to then build up to taking care of yourself. But I'm hoping I'm not biting my tongue as I say this, but definitely learn it early and make those habits early in your life, early in your career. even now as college students, right? Learning how not to procrastinate, and giving yourself enough time so that you can then focus and really give it your all.
Yeah, I think those are great advice, and absolutely, you need to be kind to yourself and figure out how to take care of yourself. To figure out ways that you can still appreciate the beauty in the world. It's really hard if you're working on issues like many social justice issues are, to not just get a view of the world as being horrible and having that affect your core. And so for me, it's really, I need to have people around me that make me feel good, that make me feel good about the world and make me feel good about myself, and who are willing to tell me what I'm doing right and willing to tell me what I'm doing wrong, and laugh with me about it and help me move forward. But definitely you need to search for those ways to feel good and cherish what's good in the world.
I agree with all of those. I think what I can add is just celebrate the small wins. Like when you go for the big impact, that takes years sometimes to even see, and that can be exhausting, right? Leading to the burnout. And maybe I applaud all the self-care and everything, but again, I feel like I'm not the best one to preach that right now. But I do think the small wins that you have, like when I just, a student or a patient that I have that I know I affected some change in their lives and helped them. That's a big win, and just recognizing that and celebrating that, and not going down to Anne's point, like, oh, I still have 100 other people I need to get to. But knowing that you're able to impact that one person.
Yes, I added, don't get hung up on the massive systemic inequities in your day-to-day life, because you will burn out. Celebrate those small wins. That's absolutely true.
Well, I
Chris,
think
you want to
that
give us a wrap up?
I think I definitely need to. That was such a great way to spend an hour. I was furiously scribbling notes the whole time, which sometimes I like to just sit back and listen, but there were so many good points that were brought up that I had to do it. And I was thinking of something that Alyssa said about being uncomfortable with maybe the lofty pronouncements of the panel being social justice warriors. And sometimes when we do marketing, there's some hyperbolic nature to that. But I think being uncomfortable with that is totally in line with who you all are, because you have a history of helping others and putting other people maybe before yourself sometimes. So I think maybe it's just part of being someone who fights for social justice. And I think that we all learned a lot tonight. So I want to thank you all. I mean, thank everybody for coming, and thank the panelists for sharing. Just, yeah, really, Sarah says it best. Thanks for a great conversation. I think that's what it was we got to just converse. And if there's any last things that anybody want to throw out there, it'd be great. But otherwise, good night, and thank you for coming.
Okay. Good night.
I just wanted to do a shout out for Laura. You did a great job facilitating your first Zoom event.
Thank you.
You sure did.
Absolutely. And Sarah,
Agreed. Thank you.
Thank you all.
Oh, hi, Nancy. I didn't even see you in here.
Oh. Okay. Thank
All
you.
right.
Have a good night, everyone.
Right, thank you all.
Thank you.
bye.
Thanks, everyone.